Hi, my name is Mina Marzouk. I'm a med-surg nurse. For the past 2 years, I have been working for WVU Medicine, Thomas Memorial Hospital in Charleston, West Virginia. Thank you for allowing me to speak today about workplace violence, which has reached an epidemic levels, and yet there is no federal laws requiring healthcare facilities to implement comprehensive prevention programs. As a nurse who experienced workplace violence firsthand, last year I was assaulted by a confused patient, leaving me with injuries that required medical attention. Unfortunately, this is not a unique story, but it reflects reality for nurses nationwide. Without federal protection, healthcare workers stay vulnerable to preventable harm. I urge our committee to take an immediate action. Healthcare workers face violence at rates 4 times higher than other industries. According to OSHA, 70% of nurses experience either physical or verbal abuse annually. Only 30% of assaults are reported due to retaliation or lack of institutional support. Workplace violence leads to higher nurse turnovers, worse patient outcomes, and increased cost from injuries and staffing shortage. This is not just a nurse issue, it's a public safety crisis. Nurses must be central to solve this problem. We propose 3 key actions. First, federal legislation that mandates healthcare facilities to implement workplace violence prevention plans, including staff training, incident reporting system, and security measures. Second, whistleblower protections. Safeguard nurses who report violence from retaliation. Third, nurse-led task forces that includes frontline nurses in developing state and federal safety standards. In closing, I ask our committee to support the workplace violence prevention for the healthcare and social service workers. Nurses should not have to sacrifice their safety to care for others' safety. By passing this legislation, you will save lives, both nurses and patients. Retain experienced nurses in workforce. Set national standards for healthcare safety. It is time to act now. Thank you for your time and thank you for listening to me today.